I'm Noel, I'm a psychotherapist. Short video today on oppositional defiance disorder, oppositional defiance behaviour. I'm not going to give you a full list of symptomology and treatments and stuff like that. I mean, I'll skim through that, but actually go and check out the website. There's lots of information underneath the video on the website, so hop along to that and you'll get a sort of list of things that can help you identify what it is. It's a sort of relatively new diagnosis, and I remember sort of the controversy that it sparked at the time, and really want to talk about that, about sort of children's behaviour and the impact on families and what this sort of stuff might mean for the child and for you, their carer. So oppositional defiance as a disorder can emerge sort of from young childhood right up to teens. And many people, when the sort of diagnosis first came out, they were quite concerned that it was turning normal child behaviour or young people's behaviour into an illness. And it's a sort of reasonable concern, because if you think about the lists of behaviours, what child hasn't done this? Arguing with adults, mostly those in authority, purposely refusing to follow rules and requests, actively trying to upset and annoy people or get annoyed with others, blaming others for their mistakes, seeking revenge and acts of spite, using obscene language and swearing, expressing hateful and mean things when upset, etc., etc., sort of use of alcohol and drugs. So, you know, it's possible for any child to and young person to engage in these types of behaviours. It's possible also for an adult to behave in them, but let's focusing on child behaviour at the moment. And so what makes the difference between what might be seen as normal dysregulation, let's call it, in a child, because they're not mature enough yet to sort of manage themselves in all situations, and abnormal or ill behaviour? I mean, I suppose it's really, if you talk to parents and carers of children with these disorders, what they will tell you is the difference is in the sort of magnitude, the severity of it, and the longevity of it. So it may be that you will have a temper tantrum from a young child, but it's going to stop. You know it's going to stop. What if you knew it wasn't going to stop, that it was going to be like that for the next few days, next few weeks, months? What would it be like then? And that's really the big difference that we're talking about here. So those children where you actually sort of know it's not going to stop, that it's just going to continue and maybe even escalate into something, and that you end up sort of walking on eggshells around your own child. It can be extraordinarily difficult. I mean, often the child in question will have other issues such as ADHD or ADD or some other cognitive processing issues. There may be deficits in brain functioning in terms of neurotransmitters. There may be a genetic history involved, so that this type of behaviour is passed down sort of through the family tree, and you can check this out. You can have a look at the family tree. The prognosis is quite serious, and it is quite a serious issue, so I think it warrants a diagnosis. With that, of course, you then point you at services once you have a diagnosis, and that's really the point of any sort of diagnosis around children. It's not to label them for the rest of their life as something, but to indicate what type of services might be available, might be needed to help. And the sorts of things that do help, that we know help, are forms of psychotherapy, both individual for the child, but also for the family as well, to look at the family's coping mechanisms and increase what I think of as the resilience of the family. Often a lot of effort and attention will go on to the problem child, trying to sort them out, quite rightly so, to give them sort of the help that they need. And then the parents and the other siblings are forgotten in that. And so I think that there's just as much important work needs to go on around that child. it's a family around the family approach, if you want to know what the term is, or a team around the family. And that's likely to produce much more sort of effective outcomes in the long term. Treatment is possible for this. That if you get in the right combination of services, which would be sort of medical, so looking at any medication issues, because often there may well be other issues going on, such as anxiety, some sort of mood disorder or depression, etc. Looking at that, so getting a good sort of psychiatric assessment, getting good psychological assessment to look at the therapeutic interventions that will work, look at the family support systems, look at the peer group for the young person and support through that. So because peer modelling of good behaviour is very powerful, so you can find groups where children have recovered from this, and you can become part of those types of support networks that will be very helpful. The prognosis is great, I mean, if you get this issue early enough, and that's another thing about supporting this type of diagnosis is once it's out there, then it's a question that people can legitimately ask of themselves. Does my child have this? Do I need to go and get them assessed for it? Asking that question and then going to get the assessment, even if the assessment says no, your child's fine, which is hopefully what it will say, but you're just going through a sticky patch at the moment. But if the diagnosis or the assessment does say, yeah, it seems indicated, let's get some treatment in, the earlier you get that, the earlier you get the treatment, the more effective it's going to be. And the reason why we want to do this is because the life outcomes for somebody in that situation are pretty rotten. So just think about it for a minute. If somebody goes through a period of months or years of challenging all authority, of being antisocial in behaviour, of doing risky behaviour such as using drink and drugs, what do you think are going to be the outcomes for that person? Have a think about it. It's not great, right? So actually it is important, this whole issue of looking at sensitively doing diagnosis and then thinking about the sort of services that you need to put in place to turn a situation around. I hope that's useful. Do go and check out the website because it gives you some signs and symptoms and a bit more information on the process of assessment and diagnosis and the process of the types of services that you might need. If you have any concerns about this within your own family, maybe about yourself, for example, do get in touch. The email is info@noelmcdermott.net or call 07 506 319 745. That's a mobile number. If you're calling from outside of the UK, then drop the first 0 and add 0044. Or +44, which if you're using a mobile. Do get in touch if you have some issues that you want to discuss around this, or it's brought up some issues for you. I'd be glad to talk to you about it, and then maybe we can look at whether you need some extra services. Thanks for joining me today. Do leave commentary on the video below. Let me know what you think about it. They are hopefully useful, these videos and these vlogs. The only reason I know they are useful or not is if you let me know. All right. Thanks for joining me, and I'll see you again soon. Bye-bye.